It's sharp too, sir. So with all your due permission, we are beginning with the session for today. So shall we start?
Okay.
Thank you so much, sir. Good afternoon, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, who is present here with us today. Well, he's none other than Dr. T.N. Ravishankar, sir, and he needs no introduction at our platform, but it's our great pleasure and honor to have him with us at our forum. He is MBBS, DFM from Colombo, FCGP, PGD, MLE, MBA, and family physician at Sudhar Hospital, Chennai. With Sir's enriching experience and with his wonderful talk, we are going to talk about the topic for today, which is leadership in quality service in health sector. Before moving on to today's session, let us have a brief look on what the topic says. Leadership strategies for quality services, quality improvement, data-driven module, and decision making will be discussed in this particular session. We'll be gaining insights into the current state of healthcare industry and the challenges faced in delivering quality services. We will understand the importance of patient-centered care and how leadership can shape a healthcare environment that prioritizes patient satisfaction and well-being. In this insightful webinar on leadership and quality service in health sector, where industry experts and thought leaders will explore the pivotal role of leadership in delivering high quality healthcare services will be discussed. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his talk to begin. So over to you.
Thank you. Good afternoon. Is the audio okay?
Yes, sir, perfectly audible.
Thank you. Thank you. Thank you for this opportunity given from the platform of IJCP. I think Dr. K.K. Agarwal needs to be remembered and thanked for all this, taking forward the digital platform to every person in the whole country as well as in the international arena and trying to give the best to all the people, the knowledge. Sharing knowledge is such a great thing in the society, which has not always been done by everybody. And Dr. K.K. Agarwal has been a person who had done it, and he is allowing the next generation to come forward to do it. Thank you on behalf of myself and my management for giving me an opportunity to talk on this leadership in quality healthcare delivery. Right from the late 90s, the quality had become a synonym with the healthcare industry that everybody wanted to gradually change the concept of the healthcare delivery. What was an individualized care in the society became team management, people coming together and starting a hospital and running the show. And then today, in the last 10 years, corporates has emerged. What had been a trust hospital when the trust was so much nice between the doctor patient, that's now become corporate, public limited, private limited, and all these things have come. And slightly the trust between the doctor patient has dropped down. And when the healthcare professionals, more than the healthcare professionals, the administrators, so when they saw it, they thought something should be inculcated into the healthcare industry for people to have the trust and come to the hospital for a better care and treatment. And that is where the quality came into the force. We have the QCI of India coming in the 90s, and then when they started, it was for the industry, and there was one person, Dr. Giridhar Gani, who thought it will be the most ideal for the healthcare industry, and he started the quality for healthcare industry, though he was not a medical doctor but an engineer by profession. What is health? An introduction to the quality in healthcare. The degree to which healthcare services for individuals and population increases the likelihood of desired health outcome. Only when you provide a good quality services, can we expect the patient to recover? It is not the quality services alone, professional work and professional work associated with the paramedicals and allied people working together. What was thought only the paramedical and the allied health people, the entire hospital will have to work in tandem for the patient to reach their hospital, to have a pleasant atmosphere for his mental well-being to come out of the physical disability. And how is that quality in healthcare being talked about? It enables a comprehensive patient information tracking system. Once upon a time, when the doctors were individualized, they could remember the patient, the population reaching them will be quite less in number. They might be able to spend 15-20 minutes along with the patient, even for a general practitioner, though today a consultant or a super specialist only spends so much of time with the patient. They will be able to know every detail about the patient, but today we need a system to understand and remember what is happening for your patient, and that depends on an informed decision making, improved services, driving the patient to satisfaction that imparts patient's best outcome. And that is the significance of equality for patient satisfaction and safety. You know all information about the patient, though you don't keep it in the natural computer hardware, your brain, you have it in an artificial hardware. Today you have an artificial intelligence also. The dimensions of quality in healthcare depends on, or you talk about now, on patient-centric care. The last 10 years or 15 years, I think the scenario has changed. When patient reach the hospital, thinking that the hospital and the doctor alone, but today the reverse is happening, that the patient are being woved in by the hospital and the trust between the doctor patient that makes the patient come into the hospital. You have a good consultant in your center, and that person is able to wove the patient to reach your place, and that is where it becomes a patient-centric care. And that consultant who's been sought after by the patient are doctors who have patient-centered care provided. Safety is the biggest issue today. You walk on the road, you have a trouble, but when you walk into your hospital, you should not have any problem. They always compare the aircraft and the hospital industry. If an aircraft keeps falling every day, people will never go in to travel in an aircraft. So similarly, if there is going to be a problem every day in a hospital all over the world, then the safety is a biggest concern, and that safety is one of the most important criteria for providing a quality health care. The effectiveness and efficiency all depends on the knowledge of the service provider, as well as the paramedicals who are being updated or who have a good knowledge and qualification. Timeless. Timeless, it means an emergency in a hospital industry need to be taken care at any time of the day, be it 2 a.m. or 2 p.m. or 6 a.m. or 6 p.m. Or if you are even worked for 8 hours is not a closing time for a medical professional or a paramedical. If there is an emergency, they need to stay back and provide the necessary care, and they should not care about the time that is being clicking on their watches. And equity. It is not equality, it is equity. Everybody should get everything clear. What is being provided for the rich or the poor, there should not be any difference. And religion and caste should not have any difference in it. And that is where the quality healthcare stands. When all these things are being provided, you have a good patient outcome. The patient recovers well, quite well. And at the same time, they have a good satisfaction. When the patient's outcome and satisfaction are there, and if you have a good outcome in a short time, there is a reduced cost in the healthcare industry. When there is a reduced cost in the healthcare industry, and if you provide a good outcome, you will be able to get an accreditation, and you will have a good compliance with all the people who want to try and utilize your healthcare services for their patients or for their relatives or whoever it is. There are a lot of tools to measure the quality, like continuous quality improvement. You have your regular programs. You have the Lean and Six Sigma methodologies, plan, do, study, and act. Yeah, I think you can understand what it is. Plan, your hospital, plan your services, do it, study it or analyze it, and then if we find a problem, then act either positive, negative, change it or whatever it is. Lean and Six Sigma will see a little later. A continuous quality improvement will have to be done always in your practice. And now let's see what is lean. Lean is a systematic approach to identify and eliminate waste in the process with the goals of delivering maximum value to customers. Originally developed in the manufacturing sector, lean principles have been successfully applied to various industries, including the healthcare. You write down a small note about the patient, the history and all these things. And you just deliver that to the consultant who is taking care of the patient. The doctor doesn't need to keep on asking a probing question or whatever it is, and just is going to see the total history of the patient. The time taken in between by the history illuminating physician assistant and the information they are going to give it to the doctor is allowing the doctor or the consultant to have more probing questions where lot of time is being utilized to the maximum point. Going back again on the same history, going back again on the same time, all these things is going to be a waste of time, and that is where the lean process. The process also involves, you have a place where you take care of the patient, take the patient immediately to the consultant, not far away, and provide them a good opportunity, not wasting their time. Most of the time, the patients keep waiting in your reception chamber for a long time. And if you try to engage them with all these earlier informations, I think patient is also going to be happy. Is going to be fine that somebody is taking care of them. This is a way of trying to satisfy the patient in a process, and that process is also depends on how much of time you are utilizing it so well for the patient and how much of information you give to the consultant, so that they need to have a lesser time to spend with the patient asking for the history, more of the time trying to elicit the signs and go forward on the treatment process. The Six Sigma, I think, is a data-driven approach aimed at improving the process quality and reducing the variations. You have a lot of variations in your lab reports. What is the pH of urine is set between 6.1 to 6.4 and whatever it is. The same way, the satisfactory level of the patient has to be at a defined point. You need to define and then measure what is the satisfaction of the patient when they are in your hospital. And you try to analyze where all the defects, where all the patient is dissatisfied, try to improve and control it. Though there are only 5 points, it is called Six Sigma, referring to the statistical measures that represent a process operating with a very high accuracy. Lean and Six Sigma are the key principles when you are trying to find out, analyze the satisfactory level of the patient and trying to provide the health care in the shortest time when the patient reaches the door of the hospital. They always say the door to needle time, and all these things have been come along only with the above two process of Lean and Six Sigma, where you analyze, improve at every point of it. And today, the integration of Lean and Six Sigma has taken many organizations. Lean and Six Sigma are integrated into a comprehensive approach known as Lean Six Sigma. This combined methodology leverages the strength of both Lean and Six Sigma to provide a holistic approach to process improvement. Lean focuses on waste reduction and process flow, while Six Sigma targets as a variation reduction and defect elimination. You may say it will take half an hour for you to take an X-ray and then come out. But then when you use the data, when you use the defined, measured data, analyze why that there is a delay in taking an X-ray in your unit in the outpatient, you analyze and try to reduce the time taken to take an X-ray or time taken for a doctor to see a consultant. and that defect has to be eliminated. The integration aims to create a more robust and efficient improvement in the framework of healthcare delivery, and that gives a better outcome. Why do we need all these better outcomes? Because the system, the healthcare system has become competitive in the universe and in every place. Even in a tier 2 city, it has become competitive. There are competitions even in the tier 3 cities from the quackery system also. Then so you need to give a quality, efficient, knowledgeable. Only with the fittest people survive in the industry. And if you survive, you have a branding as a leader in the industry, and your reputation looked as a successful physician as well as an entrepreneur if your establishment is able to provide the best and quality outcome. And that is what is quality on a very, very brief note. And let me now try to tell you something on leadership. And whatever that quality is there, I think the leadership will have to take care. Why I was so interested in talking about leadership is because the medical professionals are not interested in leadership. They are very quite happy, fine, contented, think they have done the best when they see the patient, diagnose, treat, and see the smile on their faces. But at the same time, how did the smile come around? It was not alone on the diagnosis and the treatment, but there is something behind your sisters, your diagnostics, your pharmacy, your hospital atmosphere, your infrastructure, everything is there. And this is never been taken up by the medical community as an important tool for the satisfaction and a good outcome of a patient. They think it is a manager's responsibility and managers will do. You just tell the manager what to do. Management is about persuading people to do things they do not want to do. And most of the time, your managers are like that. They don't feel happy when you try to dictate terms and you try to tell them to do all these things. But while leadership is about inspiring people to do things they never thought they could do, and that is Steve Jobs, who invented or created the Apple, or inculcated that Apple into the internet and whatever it is. I think that was the biggest achievement in his days, though we all acclaim him as a leader who had given us an Apple phone. You know what is the speciality of the Apple that is bitten there? It is like biting the information of every person in the universe and having it within the Apple. And that is what the Apple's logo means also. If you go through the system of Apple and their value for value that they have driven to the logo, you can see this biting the professionals and getting the information. But though he has been a leader, his late stages, he had lost his leadership to a different people. And what is the characteristics of a quality healthcare? It is again patient-centric, safety, effectiveness, timeless, and equal. These are all the things that has to be given by a leader. And the role of the leadership in the quality. There are several types of leadership there in the manuals, right from an autocratic, democratic, transitional, transformational, servant, and whatnot. There are so many other ways, so many other terminologies are being given for the leadership. But I think there are two things that we will have to see here is a transformational leadership and a servant leadership. Transformation leadership we'll see in details a little later with examples, but they are the people who can transform a sleepy hospital into a bright and enthusiastic hospital atmosphere. And a servant leadership is someone who can bring along the entire paramedical and allied people. Most of the time, the paramedicals and allied peoples, their job is not their love. It is not the option that they became a class 3 or a allied personnel or a technician or a staff nurse. There are times that they may have a depression that they could not become a doctor, but they still want to serve the ailing people, and that is where they would have taken this job. It's not their first job, but it is a servant leadership whose empathy and care can make them feel He is part of the treating team. And that leadership is what is needed when you need to manage. Transformation and servant leader are two major leadership quality that anybody in the healthcare industry will have to adopt, so that they give the best for the hospital, and they treat your paramedicals to the best with all the empathy. And that is where you can lead a culture for your organization. And a good leader takes the mentorship role. They try to give everything for their subordinates as well as the people working under them. And mentorship is the one that rarely and everybody gets it. And when you get a mentorship role, I think you develop a good quality of people under you. It is not that they will overshoot you, but they will always be looking at you as a mentor. And you as a mentor, you can always take them to the right route, to the right goals. Seeking opportunities for professional development. As a leader, he themselves or she themselves will have to look out for their own professional development, because without your profession in the healthcare industry, you can't make a brand for yourself. That professional development will have to be done at every point. They used to say in the corporates, 2 CMEs, 2 conferences, 1 international, 1 domestic, and all these things are aimed at giving a good professional improvement and increase your professional capacity. And at the same time, promote the opportunities for others. If there are people who are technicians taken along with you and taught something what you can allow them to do, that's a good promotional opportunity for your subordinates. Prioritize the communication. And only when you listen, you can bring out something good in your mind which could be communicated. And it is better always that you listen first. And if your ears are very, very sharp, and if you can lend more time for your ears, your lips and your tongue will need a lesser time to communicate appropriately to the people working under you. And you lead by example. If you want your subordinates to come at 8 a.m., I think you should be there at 7:55 a.m. That is how you lead by examples. And if you are late by because of any other reason, please do communicate to the appropriate person or tell them that you are late. Then only your subordinates will also inform your establishment that they are late. And there is always a leniency, there is always a leverage for everything. But one thing cannot be compromised is on ethics and high standards. The high standards comes with your professional knowledge. Ethics comes with practicing your profession with the ethics that has been evolved over the generations. And ethics has got a big, big value in your practice. It is, you may not be able to identify the ethics that you follow, but your patients and your clients definitely will be able to find out the ethics that you follow in your practice. Use active listening, which I have always said, even before communicating, it is active listening that has to come first. Demonstrate self-confidence. There are times when you will not be able to overcome certain difficulties, or it might take a longer time to overcome difficulties. There may be a patient who nags you both with his physical disability and his lack of confidence and his poor trying and your poor outcome. And all you need to do is give them a self-confidence. And at the same time, you be confident that you are trying to do the best for the patient. And if there is lots and lots of complaint, listen to the complaint, take action for it, then everything will be fine. And that is where you show your self-confidence. Your smile and your face and your body language will demonstrate your self-confidence. Know when to delegate. It is always easy to put down the work, what you have, to somebody along with you. But you should know at what point of time in their career that you can give the job to them. Analyze, assess them regularly, to what extent they have learned the knowledge in the hospital industry, and then only try to delegate the work. Practice effective problem solving. A medical professional will be easily having this scope of this knowledge, because every time a patient, give them the history and their symptoms, and you try to correlate with the signs and then the diagnostic, and that is where a problem solving happens. And same thing that can happen in the administration also. If there is a problem of losing a power supply regularly at one point of time in a day at one place, Then you try to find out at that place there is a problem in an equipment, or there is a problem of somebody utilizing it or misusing it. That is where the effective problem solving of a leader comes out. So compassion to others. It is always a problem in the healthcare industry that two people don't get along together when they work in the same place. And if they're not able to get along with them, as a leader, you should have to give an unbiased, with demonstrating a self-discipline, try to bring them together to see to that they work not for themselves alone, but they work for the institution and they work for the patient to recover. If that thing is being inculcated into your paramedicals or into your consultants as a leader, then you are a very, very successful leader. And that is where they are called a transformation leader. I think you know all these transformation leaders. Your Martin Luther King Jr. was a civil rights person in the whole of USA. And he is the first person who said, I have a dream of an America without all those racists. And Nelson Mandela had his own self-confidence and belief that it took so many years of him to be behind the bars, and that changed it. And that man with the least dresses on himself, Gandhiji, I think you know how much he changed the world with non-violence demonstration, how it could be a successful and that is why they are all called a transformation leadership. Look at a transactional leader. That is a shortcoming. Transformation leader creates a shared vision for the future, and followers are inspired by the leader to improve in a manner that surpasses expectations and eventually achieve this vision. But then transactional leader, all these things are temporary. They may show a bit of success or followers, but then it is not going to be a long-term change. Even today, whatever Gandhi did, and non-violence have always been useful in the international arena. But then there are very, very less people now trying to follow the non-violence. The leadership competence includes the visionary leadership. There are people who think long-term. Somebody who has a vision that after 15 years, how will be my hospital? How will be my healthcare? What are the changes that can happen in the healthcare industry? You keep abreast of yourself what is the development that is happening in the biomedical, in your pharmacological, or in your skills of the people who learn in the international. And when you communicate those skills to your old subordinates, I think your leadership competence is being exhibited. Team building and collaborating is the biggest achievement of any person who works within the hospital. Because every time you build a team, somebody will be getting away from it. 2 people will go, 5 people will come in, 5 with all a raw experience, 2 good experience, leave your team for somebody for a better opportunity for them. And that is where the team building becomes a very, very big issue. But if you have a confident and if you are a servant leader with all the empathy, giving all the best for your employees, then you are a team builder and you can collaborate things to the best of it. Decision making and problem solving is all known to you. I already told about building a culture of quality is by establishing a goal and expectation. A patient goes out of the hospital or somebody who walks in and goes out should have to have a walk out with a smiling face. And that is the culture that you develop within your establishment. Encouraging continuous improvement. That can be done only by listening to your subordinates or listening to your employees. Your employees can always give an input or a direct input from the patient, giving you the knowledge, giving you where we are shortfall, and that is where you can continuously improve your hospital. Empowering and engaging healthcare professionals. See to that all your employees are being upgraded regularly on their professional skills and at the same time on the soft skills of communication, because communication is the biggest goal that is needed in the healthcare industry. I think everybody will be knowing about what is change. These days, we keep talking about change, and it was long ago, several decades ago, George Bernard Shaw has said, progress is impossible without change. And those who cannot change their minds cannot change anything. When ultrasound came into the healthcare industry, it took quite a long time for the radiologists as well as the obstetricians to accept it. But then when they saw it, and finally the image building of the radiology was so high, and today it has gone to the extent of CT scan, MRI, PET scan, and all these things. And that is possible only by accepting the change. There is nothing permanent except a change. And your ultrasound is also slowly getting obsolete, and everything is now seen on a CT scan and an MRI. While change is inevitable, if change is inevitable, growth is there becoming an optional. You always need to identify the areas of improvement in your establishment. You may have 5 departments working well, but at the same time, there may be demand for another department allied with your obstetrics like pediatrics, your radiology with intervention radiology, your medical cardiac, along with the surgical cardiac. All these things has to be identified. All these things have been done by a SWOT analysis, and we do it also with regularly analyzing your data regularly. Implementing evidence-based practices, analyzing your data and trying to put down the improvement on that place. And overcoming resistance to change is a challenge for any leader, that too in the healthcare industry. Somebody who keeps working, trying to put down the IV fluid regularly. Today, there is a monitor for the IV fluids flow also. It will be very difficult to force your paramedicals or staffing personnel to accept that change. But then if you give them that change, the quality outcome is good. The IV fluid is going to flow in the rate what your consultant said. And the patient is also confident when they are trying to sleep, or somebody attenders sitting around keep seeing how many drops of fluid keep flowing. But utilizing the equipment, I think as a leader, you need to provide that resistance which they always have. There will always be a resistance when new things, when gadgets are brought in, because people will have an insecure that the gadgets might take over. Any number of AIs coming in, the human touch can never be matched at any point of time in healthcare industry. Monitoring and evaluation will always give you the best outcome, which we have been saying it repeatedly here. Patient engagement and satisfaction is the load of leadership and patient-centric. The strategic for improving patient satisfaction and communication and empathy is very important. We have a lot of quality metric measurements that are which we have to use as data. You have the number of beds, number of patients, you have a number of consultants, you have ER medical persons, 1 at a time or 2 at a time, to try to find out which is the peak hours and trying to put down more people to take care of the patient so that they don't wait in the ER. And all these things are quality metric measures. That has to be customized for each hospital and each department. There is lots and lots of templates that are available. And these are all the metric measures that we need to measure, and the link is there between the metric measures and patient safety and satisfaction. And once all these things are kept in place, you are being accredited right from the national to the international level. And your accreditation also means that your quality has improved, and you can exhibit that quality in your marketing department so that you get more patients with trust to you reach your place. The type of quality metrics, the process metric, outcome metric, and structure metric. I think your process metric is all depends on your technical people or your consultants providing you the proper examination and diagnosis and treatment. Outcome metric is also dependent on your guest patient care by your allied medical professionals, and structural metric becomes your operating system. You provide a good atmosphere, you provide a place for the patients, you provide a good ventilation, you provide all the care that is needed with them, and all the gadgets is available in your place. And there are key performance indicators. There are templates for each department, I think, which you can always utilize it. And if you keep doing it, that is where you have a managerial process. As a leader, you use your managers to assess the key performance, but when the results are there, it is you have as a leader who has to analyze, take forward the whole thing. Addressing the resource constraint, managing the resistance to change, and balancing the competing priorities. These are all a competition in the healthcare sector that you will have to take care appropriately at every place. Going through the whole process it will take a lot of time to talk on these issues. Future trends and innovations, technological advancements, healthcare quality. You just don't keep yourself within the four walls. Even when you are working in your healthcare industry, you need to move around the hospitals, move around the healthcare industry, peep into the toilets and to see how good or how neat or how bad it is, so that action can be taken. And there are a lot of technological advancements even in cleaning the toilets and giving a best patient care, and a place where there is the least infection or no infection at all. Emerging trends in leadership has to be approached. The role of artificial intelligence and data analysis has to be utilized. If anything comes into the society or on the computers, we always have some resistance to adopt to it, particularly by the healthcare industry. But then analyzing your data in the shortest time is there from the artificial intelligence. And how good and how early you try to implement in your healthcare industry, you are going to keep yourself abreast of your competitors. It is not that you are trying to suppress your competitors, but you always have to be the number one, be ahead of them in the healthcare industry. And for that, you need a good quality leader with all the empathy with themselves, with all the forethinking, with all the visionary and the communication to take it forward to the next level in the healthcare industry. Invest in leadership training and education. I think you need to find your next person. There are political parties which has crumbled because they did not find the next leader. The leader who was there at the top always had a suspicion on the next person that he might overshoot him. But in healthcare industry, if you try to do that, you will be lost. Even in your own professional, it is most ideal to have a competent or even more competent than you along with you, so that you utilize their best services to get a better outcome in your patients. And mentoring and coaching program, creating opportunities for leadership growth for your subordinates, for your paramedicals also has to be there. You can't have every paramedical to lead. You need to identify a good person there and make them the person to lead the next group of people. When you have all the department heads under you, it doesn't mean that you have to be away from the next level of employees. That is where a servant leader comes into play. And if you have that servant leader quality, then you have that empathy, care for the next level of your employees. I think I have taken a long time, or in fact, given you an overview of how the leadership can be merged with the quality services that we need to provide for a best outcome or a better outcome in the healthcare industry. Quality is what every patient expects. They want the best outcome for their kith and kin and for themselves. And if that has to be there in your healthcare establishment, it is the leadership that has to follow. And that leadership from the medical community will have more empathy, more sympathy, more care. And when you are trying to be a leader as well as a professional, you will understand the needs of the patient and give them the best in your establishment. Thank you for the opportunity given on this afternoon to share my thoughts a bit on leadership and quality healthcare. Thank you very much.
Thank you so much, sir. Thank you for such an overwhelming talk on such an important topic that you have shared today with us, and sharing the wonderful insights about it. We have received few questions from the participants, sir. With all your due permission, I would like to put across those questions to you.
Yeah, please. Yeah, please.
The first question is, sir, what kind of strategies can be adopted to prevent burnout and maintain the well-being of healthcare professionals while providing high-quality care?
Yeah, fine. Burnout is the present day scenario. I think you need a change. You need to motivate. That is what you said. A change is inevitable. Somebody whose burnout means two of the things will be there. Either they are working too much, or they have some shortage of their knowledge and skill, and that is where they are burnt out. If these two things are taken care, I think the burnout will not be there. Somebody who's in the 40s trying to learn the profession, And somewhere a patients repeatedly are there trying to complain about. There are times when patients will walk into your chamber and start straight away telling, last time you gave me a medicine, that is not helping me. If you have 3 or 4 patients in a day talking to you like that, naturally you're burnt out. And if your boss is always finding it complaining about your approach to the patient, that is where a burnt out is. And if you work beyond a scope, anybody can work beyond 8 hours, but they can't work all the 24 hours. Today, I think everybody will be saying about the NMC and the working hours and all these things. And with so much of pressure by the patients and in the industry, I think time has to be followed. And at the same time, a change has to be given for a person away from his own professionals. And today, every profession has got something else to fall upon, so that the burnt out system is not there. And that is why you need to have a fixed amount of holidays every 3 months or every 6 months, or you need to go out for a tour, or you need to go out for your conferences where you don't. Why are we getting the burnt out? We are seeing the same thing again and again. We are getting the rubbing again and again. If these two things are not there, I think you can always overcome the burnout. Practically, this is how we can change, provide a change away from the system, or along with the system. You would keep learning something. When your time, energy, knowledge is there, I don't think you will be burnt out in this profession. You will always be happy to provide your service to the patient.
Thank you so much, sir. Thank you for answering that question. We'll move to the next question that we have received. And the next question is related to communication strategies. So, what kind of communication strategies can be employed to effectively educate patients about their medical conditions and treatment options?
Transparency. All this has to be a transparency. The first time when you are trying to examine a patient, keep telling them these are the complaints which are likely to be these diagnoses. And for these diagnoses, we need to do all these investigations or so. Give them the option. You don't force them. Get their consent. Communication is one thing which has not been taught in our curriculum until the last 3-4 years, when NMC has now introduced the communication skill in practice. If you are a good communicator, then you are a good professional in your practice. The communication has to be transparent. What is the probable diagnosis? Which organ involved? What is the likely recovery? And how long it might take? What is the cost involved? You can't say it on the day one. You may take some time, but then you have to be transparent. You have to say these symptoms, I am not able to come to a diagnosis. Let me do all these investigations with your concern. Try to come down, and after 2 days, after a day, we will try to find out the diagnosis and tell it to you. Most of the time, the communication is not transparent. We try to be beating around the bush, trying to say this is this, and then finally after 3-4 days, you find your diagnosis doesn't correlate with the investigation. Then you try to change your diagnosis. But in your day one, in your career itself, coming to an acute diagnosis depends on certain investigation. Only if you have a chest pain, do an ECG with a finding, you can say that is a myocardial infarction. But if the ECG doesn't have a ECG changes, all you need to have to say is, if the patient has a comorbid, let us wait for a hour or so, see your symptoms, and then find it. Accept the fact that you are not able to come to a diagnosis, and you need these investigations, or you need this consultant, or you need somebody higher qualification to decide on this. Just because we are not transparent, just because we are not accepting the fact that we are unable to make an appropriate diagnosis, your communication fails. And communication is a tool that in a hospital industry, we need to communicate regularly with regular intervals. And whenever there is a change, what really happens is you do an investigation and you say in 8 hours time, you have the investigation reports. But you come to the patient after 16 hours, and that 8 hours, the report there, he will try to Google, Bing, or Yahoo to find the results. And that result is going to be a empty number of differential diagnoses. So one single communication of yours saying that this is not malignancy is going to give him lots and lots of peace. And for 8 hours delay, in your arrival is going to become a trouble. And today, with the digital technology, you can always communicate without being in person or in physical along with the patient. Communication, transparency at the earliest, accepting the fact has to be followed for a successful communicator in the healthcare industry.
Thank you so much, sir. Thank you for answering that question. And before concluding the session, we would like to take the last question of the session for today. And the question is, in what ways can doctors foster effective collaboration among healthcare team members to enhance overall patient care?
Can you repeat the question? What?
Sure. In what ways can doctors foster effective collaboration among healthcare team members to enhance overall patient care?
Transformation leadership, that's what I said. And if you are being able to inspire, inculcate that whatever you want to do, that is where a transformation leader is. What Gandhi did was everybody follow non-violence. That is what a leader is. You need to inspire, and when you need to inspire, you have to assure them what is going to happen if we all communicate. You have a meeting in the morning. Every day morning, 8 o'clock, you assemble there. You have all your primary people standing there along with you. It should not be a long talk, a quick, crisp talk. Today, we have this amount of patient. These are patients with trouble. We will try to work on it. We will try to come to a diagnosis. And this person, that person has to be. Delineate the work appropriately. Communicate. Inspire them. Make them think to the next level. This is how a team has to be formed. Your own colleagues will need to be given updated. You need to inspire them to think to the next level. Or else he is going to go ask a few questions whether the patient had his food or not, whether he is comfortable or not, just leave it alone. Allow him to think to the next level. Inspire him. Assure him that whatever he comes forward, you listen to him and then finally make a decision. When you listen, when you inspire, when you motivate, I think that is where you can make a good team, and that is how a team can be formed in the healthcare industry to collaborate with each other for a better patient outcome.
Thank you so much, sir. Thank you for answering all the questions. It was amazing to have you at our forum and to listen from you related to such an important topic and such important insights that you have shared about the topic. So thank you so much for that. And at the outset, I would also like to thank all our participants for their ardent participation that they have shown by staying tuned with us and by providing us such amazing questions. So thank you to all of them. And with this, sir, I would like to have a last take-home message from your end before we conclude the session.
Noblest profession, excellent healthcare industry, a good atmosphere in our country, and if everybody becomes a good professional with all the empathy and have the leadership quality, I think this country will be the #1 in providing the most satisfying healthcare for the citizens and for the ailing population. Thank you.
Thank you so much, sir, for such a valuable take-home message. Thank you. With this, we would like to conclude the session here for today. Until next time. Thank you, sir.